Today we're going to be talking about rehabilitation and related legislation post-1973. And there are a number of legislative acts that I'm going to be going over, and hopefully these will enlighten you regarding the impact and the nature of legislation since the 1973 Rehabilitation Act. The first act that I'd like to talk about is the Education for All Handicapped Children's Act of 1975, which was later renamed the Individuals with Disabilities Education Act, which was Public Law 194-142. This act, along with the Rehabilitation Act of 73, provided a mechanism to assure that children and adults with disabilities are provided the opportunity to be integrated into society in the least restrictive environments and manners possible. And the Education of Children's Act also mandated that all children be given, at least all children with disabilities, be given access to a free and appropriate public education. And it's interesting because the Education for All Handicapped Children's Act, the IDEA, Individuals with Disabilities Education Act, was in some ways seen as parallel to the Rehabilitation Act. And what it did was that it opened up the school environment to individuals with disabilities. Now, where it differed in some respects, obviously, the Education Act dealt with schools, the Rehabilitation Act dealt with adults and employment, is that, as we've talked, rehabilitation is an eligibility program, and education is entitlement. You're entitled to the service. There was a clash about 7 or 8 years later, which to some extent is still ongoing, but the clash was that when students from public schools or from schools graduated, they looked, and their parents and significant others looked and said, okay, well, what's next? What is my child doing, or what am I doing next when I transition out of school? And one of the things that they found was the public rehabilitation program. But what they also found was a program that was based not on entitlement, but on eligibility. And the eligibility standards, as we have discussed at the time, were not always seen as very conducive or inviting to individuals with disabilities. So there was a lot of friction that occurred. And out of this, and it's still evolving, but out of this came the notion of all people can work, which came from the special education side of the professional field, where the parents and family and consumers and professionals all said that just as all kids can go to school, all kids ought to be able to work, or all adults ought to be able to work. And so this expanded the concept of employment and rehabilitation to the point where what we look at in rehabilitation now is that it's not just competitive employment that constitutes employment, but it can also be such things as supported employment. So that's where the notion of all people can work came from. So it doesn't necessarily mean that it's work in a competitive work environment. It may be in a competitive work environment, but under supported conditions. So you had that clash occurring. You also, and this takes us into the 1980s, you also had, when the special education population was looking at rehabilitation, they looked at rehabilitation facilities, and they saw, at that time we called them workshops, and they saw environments in which they, in some ways, said that this is not going to be very beneficial to our population. And so rehabilitation was challenged in this regard, We were accused of warehousing people in rehabilitation facilities, and out of this flowed more community-based programs of evaluation and assessment and training, and also out of this flowed the concept of community-based rehabilitation programs, not just, quote, sheltered workshops. And of course today we really don't use the term sheltered workshops. So in any event, that's some of the history of what happened with the Individuals with Disabilities Education Act and how it impacted the public rehabilitation program. In 1978, the Rehabilitation Comprehensive Services and Developmental Disabilities Amendments were passed, and this piece of legislation expanded services to persons with severe disabilities, and it also extended vocational rehabilitation services to members of American Indian tribes who have a disability and reside in reservations or on Indian lands. This act also established, at that time it was called the National Institute of Handicapped Research. It's now known as the National Institute on Disability and Rehabilitation Research, whose mandate is to provide and coordinate research activities that enhance the quality of life for persons with disabilities, not just employment, but also independent living and quality of life issues. This act also established the National Council on the Handicapped, which is now known as the National Council on Disability, which was mandated to increase consumer involvement in rehabilitation. And this is not legislation, the third one, but the Office of Special Education and Rehabilitative Services was created in the U.S. Department of Education. And you also had, I believe, in the late 1970s, during the Jimmy Carter administration, education had been part of the Department of Health, Education, and Welfare. And in somewhere in the late 70s, probably around 78 or so, as one of the campaign promises that Carter made, he established the Department of Education, and pulling education, the E, out of health, education, and welfare. And I believe that cabinet was renamed the Department for Health and Human Services, and of course education had its own designation. And rehabilitation was put under the Office of Special Education and Rehabilitative Services. And the Rehabilitation Services Administration administers the Rehabilitation Acts, and the Office of Special Education Programs administers services for children with disabilities and educational programs. The Rehabilitation Act amendments of 1984, known as Public Law 98-221, assured consumers that they would receive services from qualified rehabilitation professionals. And this certainly has an impact on our functioning as professionals, because out of this later on flowed the mandate that professionals have a master's degree or an equivalent degree and be certified as rehabilitation counselors. Of course, states have some latitude with regard to that, but basically the mandate is that states have to employ qualified professionals, qualified rehabilitation professionals. A rehabilitation education group called the National Council on Rehabilitation Education in 1987 provided the following definition of qualified professionals. These are individuals who have received an academic degree from an accredited education program accepted by the rehabilitation profession as denoting professional status, is certified and or licensed to practice in accordance with the Rehabilitation Professionals National Certification Board or Commission, and or the state licensing board, and maintains his or her certification and or licensure by completing continuing education units approved by the Certification or Licensure Board for renewal of certification or licensure, and has completed the amount of time on the job specified by the profession as denoting achievement of, quote, journeyman status. So this certainly had an impact on rehabilitation professionals, because it was the beginning of leading us towards a more professional approach to providing services and having standards that the public could recognize as being required in order to practice as a rehabilitation professional. Then in 1986, the Rehabilitation Act Amendments, Public Law 99-506, extended and improved the Rehab Act of '73, and it mandated gender-neutral terminology, and it phased out the concept of handicap. It changed the name of, as I said before, the National Institute on Handicapped Research to the National Institute on Disability and Rehabilitation Research, and the National and Council on the Handicapped was renamed the National Council on Disability, and the President's Committee on the Employment of the Handicapped became the President's Committee on the Employment of People with Disabilities. This act this amendment also provided new provisions to the IWRP, Individual Written Rehabilitation Plan at the time, as it was known, to include statements of determination of employability, long-range rehabilitation goals, intermediary goals, and this had to be based on the evaluation of the person's rehabilitation professional. The Act also mandated that that services for independent living be provided. The Act required that states establish an independent living council, and this was mandated to provide guidance in developing and expanding independent living programs, including recreational services, and every state was mandated to have an independent living council. We've already talked about the Americans with Disabilities Act, Public Law 101-336, which was signed into law by President George H.W. Bush on July 26, 1990. I will briefly review that for us. That act, the Americans with Disabilities Act, had 5 provisions, employment being the first, and as for us probably the most critical. Employment talked about a qualified individual with a disability who, with or without reasonable accommodation, can perform the essential functions of the job, and that pre-employment medical examinations would not be allowed, and only medical examinations could be provided after a job offer has been made, and only if everyone is required to go through a medical examination. Reasonable accommodation was designed to make existing facilities accessible, including job restructuring, modified work schedules, reassignment to vacant positions, acquiring equipment or devices, adjusting training materials or policies, providing readers for persons who are visually impaired or interpreters for persons who have hearing impairments. And those will be some examples of reasonable accommodations. Employers are also required to indicate the essential functions of the job, and the person with a disability is obligated to say whether he or she can perform the work with or without a reasonable accommodation, and then the employer would make a determination as to whether that reasonable accommodation would create an undue hardship. Basically, undue hardship means a significant difficulty or expense to the employer in making that accommodation, such as the nature and the cost of the accommodation, and that would be in part based upon the size and the resources and the nature of the business, and the number of other employees, and the nature of the business's operation. Title II of the Americans with Disabilities Act had to deal with public services and public transportation, and prohibited discrimination from participation in services, programs, or activities of any public entity, including public transportation systems. Title III had to do with public accommodations and services operated by private entities, and this basically talked about or impacted private transportation services. It impacted stores and facilities and buildings to make all of those accessible. Title IV dealt with telecommunications and TTD and TTY devices to make sure that people with disabilities had access to communication, particularly people who had hearing impairments. It developed a relay system for telecommunications. And finally, Title V was titled Miscellaneous Provisions, which in essence discussed the relationship that the ADA had to other laws and to other statutes, and how any contradictions or disparities would be resolved. Again, the Individuals with Disabilities Education Act, Public Law 101-46, changed the name of the act from the Education for All Handicapped Children's Act. And this act also strengthened parental involvement in eligibility and placement decisions, and the inclusion of children with disabilities into general classrooms, and it also strengthened the IEP, which is Individual Education Plan. The Technology-Related Assistance for Individuals with Disabilities Act amendments, called the TECH Act, Public Law, initially Public Law 103-218, which was updated in 1988 to Public Law 100-407, authorized the National Institute on Disability and Rehabilitation Research to fund in each state programs that examined the delivery of assistive technology and devices to individuals with disabilities. And this resulted in numerous grants being given to states to develop technology programs. And of course, this has been expanded with the impact of personal computers and other types of communication devices. And there's been obviously a great expansion of technology and the use of technology for learning, for communication, and for performing work activities as a result of the Technology Act, and as a result of the increase in technology. The Rehabilitation Act amendments of 1992, known as Public Law 102-569, talked about disability, changed, kind of, again, making rehabilitation more consumer friendly, talked about disability as being a natural part of the human experience, which in no way should diminish the rights of persons with disabilities in any aspect of their lives. And it attempted to change the perception of disability from a person being unable to being one who has presumed ability, which meant that individuals can achieve meaningful employment and integration into society with the provision of appropriate services and supports. It also addressed the burden of eligibility from the consumer to the agency, where again, trying to make rehabilitation more consumer-friendly, that in addition to presumed benefit of rehabilitation services, rehabilitation professionals could also rely upon the use of existing information to assist the consumer in terms of making an eligibility determination, and also could rely upon self-statements of the individual as well as self-statements of other individuals in terms of eligibility determinations. And again, that was designed to be more consumer-friendly, so it wasn't just the professional who made the decisions about eligibility without input from consumers or without having the ability to collaborate with consumers. So, and it began to make the consumer a more co-equal partner in the rehabilitation process. And obviously, we exist to serve consumers, and it makes sense to have as much consumer input and involvement as possible. Now, rehabilitation capacity building is not so much an act as an approach, and in rehabilitation capacity building, it mandated that rehabilitation counselors be prepared who are prepared as professionals who are from culturally diverse backgrounds, and it also looked at the establishment of additional rehabilitation programs in historically black institutions as well as other diverse types of institutions that had not traditionally provided rehabilitation education types of services. In our case, we collaborated with a historically black university, Kentucky State University, and we established what we called an endorsement curriculum and later a University Scholars Program, which had the effect of enabling persons from those programs to come into our program, take several classes as undergraduates, the introductory classes, and then come into our program as graduate students. The School to Work Opportunities Act, that should be 1994, was Public Law 103-329, was created to assist students in making the transition from school to work. The goal of this act was to increase education and career opportunities by promoting business and education collaboration. And of course, we would be, as rehabilitation professionals, very much involved in this type of program, so it certainly had an impact on us. The Health Insurance Portability and Accountability Act of 1996, known as HIPAA, was established, and that's Public Law 104-191, was established to increase health care access and security. And the most widely recognized aspects of HIPAA revolve around privacy and security standards, which were enacted by this legislation. It also addressed the requirement for consumer consent before releasing information and the need for authorizations to disclose information about consumers. The Workforce Investment Act of 1998, Public Law 105-220-220, was significant because it consolidated a variety of employment and training programs into collaborative statewide systems. Out of this came the notion of one-stop programs. WIA superseded the Job Training Partnership Act, and significantly it also subsumed the Rehabilitation Act. So although we were in education, the Department of Education, we were now put under the Workforce Investment Act. And the Workforce Investment Act mandate was to provide employment, job retention, and increased earnings potential of consumers by providing a wide range of workforce development activities and services. And again, here we have the the one-stop programs where a consumer would go to a location and there would be a variety of human service programs available to work with that consumer. The mandate, the goal of the Workforce Investment Act is to connect the community, employers, and the workforce and provide measures that allow employers to have access to individuals with disabilities. It also included not just people with disabilities, but other individuals who are underemployed, veterans, new people just entering the workplace, as well as people transitioning from one job to another. A significant portion of the Workforce Investment Act included the Rehabilitation Act amendments of 1998, and these amendments focused on increasing consumer choice by mandating that consumers are provided with information and services that allow them to make informed decisions. So here we have, out of this act, the notion of informed choice. And it also provided technical assistance, and there were the one-stop programs that came out of this, which were designed, again, to provide services in a more efficient manner. Now, let me just talk very briefly about the notion of informed choice. I think that sometimes there's some confusion about this. Informed choice is not the same as whatever the consumer wants. Informed choice is based upon the consumer being provided full knowledge of options and opportunities, and informed choice is done in light of the person's abilities, and the professional helps the consumer examine and explore his or her abilities, examine and explore all of the choices, not just one choice, and then helps the consumer make an informed choice. It's not just any choice, but it would have to be an informed choice, and the consumer is obligated to adhere to the concept of informed choice and be able to make that informed, intelligent choice based upon all of the information. Obviously, there are conflicts that can come about where the consumer wants something which may not be indicated or supported by the data regarding, let's say, abilities, and this is where sometimes counselors would need to go to supervisors to try to resolve any discrepancies or differences between what the consumer would like to choose and what would be reasonable and appropriate based upon the consumer's abilities and functioning levels. Okay. And finally, I'd like to talk a little bit about the Ticket to Work and Work Incentives Improvement Act, and this was 1999, Public Law 106, 171. The Ticket to Work Act basically talked about helping people receiving Social Security disability to remove the disincentives to employment, and it expanded Medicare and Medicaid coverage for individuals with disabilities who attempted to go back to work. And persons on a disability were given a ticket which they can use to obtain vocational rehabilitation services and support services from employment, what are called employment networks, who help to provide services. And the idea of the Ticket to Work Act was to enhance the return to work of people on disability, Social Security disability, to enable them to go into employment. It was never felt that it would have widespread impact. It was felt that even if a very small percentage of individuals took advantage of it, that it would still reduce the amount of money being paid out in disability benefits. But consumers often have questions about whether or not they'll be able to get back on disability benefits if their employment situation doesn't work out, and so there's always skepticism and questioning about whether this is something that someone should take advantage of. So it's the Ticket to Work program over the years has had only mixed results, but it has had some positive impact, certainly. The other important legislation that is part of our discussion we've already talked about, and that was the amendments to the Rehabilitation to the Americans with Disabilities Act of 2008, and those amendments, as we talked, were designed to address some of the loopholes that were discovered in the initial ADA and some of the ways in which the court system had narrowed the definition of who was a qualified individual with a disability. And as I said, we've already talked about that. The impact of that legislation is yet to be felt because it is just being implemented. So that ends our discussion of legislation post-1973.